Atopic dermatitis, information for patients and families. This is an introduction to atopic dermatitis for patients and families. This presentation will review the background of atopic dermatitis, followed by the management of atopic dermatitis, including bathing practices, how to apply medications, and how to apply moisturizers. What is atopic dermatitis? Atopic dermatitis, also known as eczema, looks like dry, itchy, red patches of skin that are inflamed. Atopic dermatitis tends to run in families with dry skin, asthma, or environmental allergies. There is no cure for atopic dermatitis, although it usually can be controlled with good skincare and by avoiding environmental triggers. There are two types of bathing care, the dry method and the wet method. The wet method is most often recommended for children with atopic dermatitis triggered by environmental allergies. Your healthcare provider will recommend which bathing practice is best for you. For the dry bathing care method, limit bathing to 1 to 3 times a week or as directed. Bathing should last no more than 5 to 10 minutes. Use a moisturizing cleanser such as Dove Sensitive Skin Bar Soap or another gentle cleanser that has no fragrances. Do not rub the skin and do not use a washcloth. When done, pat the skin dry with a towel gently. Apply topical medication to the flared areas first. Then wait 30 to 60 minutes after applying the medication to apply the moisturizer. This is known as the sink and seal method. For the wet bathing care method, bathe nightly using lukewarm water. This helps to remove allergens and bacteria. Use a moisturizing cleanser such as Dove Sensitive Skin Bar Soap or another gentle cleanser that has no fragrances. Do not rub the skin and do not use a washcloth. When done, pat the skin dry with a towel gently. Apply topical medication to flared areas first, then immediately moisturize all over. Your healthcare provider will determine which method is best for your child. Applying topical medications. Apply a thin layer twice daily. If there is improvement, you can use the medication once daily or limit it to 3 times per week. Apply only to the affected areas as needed and avoid the normal skin. Discontinue the medication when the redness, scale, and itch resolve. Restart the medication if redness, scale, or itch return. Discuss this with your child's healthcare provider. Applying moisturizers. Moisturizers are the main treatment for atopic dermatitis. Moisturizers should be applied 30 to 60 minutes after the topical medicine is applied, unless the wet method has been recommended. This method allows time for the medicine to be absorbed before the moisturizer seals in the medication. Ointments and creams are the recommended moisturizers. Do not use moisturizers that come in pump bottles, as these are usually lotions. Avoid scented and alcohol-containing moisturizers, as they may further irritate the skin. What are topical medications? Topical medications are creams or ointments that are applied to the skin. These include topical steroids and topical calcineurin inhibitors. Topical steroids help to decrease redness, scale, and itching. There are 7 levels of steroid strength. Your healthcare provider will inform you which one is best for your child. If you use the medication as prescribed and follow up with your healthcare provider, side effects can usually be avoided. As with all long-term medications, regular checkups with your healthcare provider are important. Your healthcare provider may recommend an alternative to topical steroids called topical calcineurin inhibitors. Examples of these medications include Elidel cream and Protopic ointment. These are safe to use on the face, around the eyes, and in the folds, such as the armpits or the groin. They can also be used as a longer-term medication elsewhere. Take-home points. Atopic dermatitis can be controlled, but not cured, with proper use of moisturizers and medications. Some children outgrow this condition as they get older. Work with your healthcare provider to find the best regimen for your child. We hope this video has been informative and will help you feel confident caring for your child with atopic dermatitis. Additional questions may be directed to your healthcare provider.